I do not expect there to be any changes because the data continue to show that that the original guidelines were based on had a very sound scientific basis.
So is it your sense at this point that despite the stories that you have heard that are documented in Pam Weintraub's book and in Kris Newby's film of people who have continued to struggle with this for any number of years, that a simple course of antibiotics for a limited period of time is still the best course of action to follow?
Well, let me separate. Let me make a couple things clear.
Sure.
Our goal is to do the best for patients. What we want is for patients to feel better and to be cured. So I think that there are some misperceptions when somebody hears some of us say that Lyme disease is not the problem. Is not the same as a lot of the patients feel like they're being dismissed and being told, oh, you're crazy or something. That is not what I feel bad for those patients, and I don't and cannot dispute that they're having exactly the symptoms that they're complaining about. But I think what we do need to do is to base our approach to it on sound scientific data.
So is it your continuing belief that people who have had these ongoing symptoms, sometimes for decades, not that those symptoms aren't real, you would accept the reality of their experience, you're just saying it's not likely to be Lyme disease?
Right. And, this has been studied extensively in many, many, many different centers, not just one study, but many. And it turns out the majority of such patients that have been evaluated have no evidence of ever having had Lyme disease. You would think they have chronic Lyme disease. You would need evidence of either having had it in the past or currently having it, but the majority don't. Now, there is a subgroup of patients who clearly did have Lyme disease and go on to continue to have symptoms. There's no question about that. We call it, for the first 6 months, it's called post-Lyme disease symptoms, and then if it persists more than 6 months, we call it post-Lyme disease syndrome. And in fact, there have been at least 5 double-blind, randomized clinical trials, the most rigorous type of scientific study conducted by a variety of different investigators, including, by the way, an investigator from Columbia University who is a member of ILADS and is a proponent of long-term therapy. And the conclusion of all of them is that long-term antibiotics are not beneficial. Now, it's not that people's symptoms don't change. In fact, in some of the studies, up to 40% of the people who got placebo got better, improved or completely got better. But the point is that there's no evidence that these antibiotics have any beneficial effect over that of placebo. And the other critically important point is that these long-term antibiotics have many detrimental side effects, both for the individual who is receiving them and for society at large.
Professor Shapiro, let me hold you there,
Sure.
if I might, because we want to get other calls in on the line. If you want to stay with us, if you have time to do that, we'll keep you on board.
I have a little time, I do.
Okay, we'll keep you on board, but we want to get other viewpoints and other listener calls as well. But thanks for calling in and adding your perspective. Pam Weintraub, this gets us right back to what you write about, that the difficulties of weighing this, that one study says one thing, one study says another, that it's difficult to sort through. That's your job as a science journalist, to try to figure this out.
I think that Dr. Shapiro is being too broad in his assessment of these studies. The first study, the one that really has been pivotal in narrowing insurance company coverage, the Klempner study, I'll tell you, Dr. Shapiro knows I interviewed him, but I interviewed many other academics in the mainstream. Quite a number of them on the QT told me that study was just insurance company medicine. That first study, the Klempner study, had 75% of the patients were patients who had failed treatment for early Lyme disease. Many of them were entered into the study because they had the rash. That's how you really define early Lyme disease. The point is that patients that fail standard treatment for early Lyme disease are by definition outliers because most patients don't fail treatment.
So your point, just
so
so we can be...
they're an unusual group.
So just to be clear on what you're saying, that this study was focused on people who were already difficult to treat. So it's not a fair representation? Is that your point of whether long-term therapy would work?
And then I will mention the other studies. One was by Krupp and the other was by Fallon. The Krupp study found that in terms of fatigue, patients that got additional treatment actually did have a resolution of their fatigue, although they're not their cognitive problems. However, she concluded that the side effects of the antibiotics was such that that it didn't warrant extra treatment, and Fallon likewise found some kind of effect. I think the reason for the effect is unclear. The other thing is the Klempner study, where he had looked for signs of active infection by doing PCR, by doing all kinds of tests, and he says he found nothing. And these studies are problematic.
Let me ask one other point, though, that Dr. Shapiro raises, Kris Newby, which is, and that's something that you hear commonly, and probably every parent has heard at one point or another, you don't want kids to be on antibiotics forever. That breeds other superbugs, that there are lots of problems with antibiotic resistance if you overprescribe them. Isn't that a valid concern that Dr. Shapiro brings up?
Yes, but if the alternative is a debilitating neurological disease similar to MS or Parkinson's or ALS, that's a decision that's easy to make. And so, with the IDSA guidelines, I mean, I think the big flaw with them is they were written by almost 100% academic researchers, and stakeholders in these guidelines were not allowed to participate. So that's physicians who treat Lyme on the front lines and treat these chronically ill people for years and have, some of them have treated 7,000 to 10,000 Lyme patients were not included. And this is valuable information. This group of academic researchers calls patient feedback anecdotes, and I say that's evidence that needs to be combined with the academic research.
Dr. Shapiro, let me get you in for a brief response, and then I have to get back to our other callers. But you heard, I'm sure, both what Kris Newby is saying about the need to get other feedback besides just from academicians, and also Pam Weintraub's a central point that the studies to date have certain flaws built in because they didn't look at a broad enough population of long-term Lyme disease sufferers.
Well, I think that what the studies did look at were the people that part of the problem was that they required some evidence of Lyme diseases, and as I told you, the majority of patients that are diagnosed with chronic Lyme disease, in fact, have no evidence of ever having had Lyme disease currently or in the past.
But isn't that part of the difficulty, that it's hard to get that evidence, that some of it is based on clinical observations as opposed to...
There's no evidence that they have it, but somehow a Lyme literate doctor knows that they have it. I think you have to base it on scientific data. Now, I will be the first to admit that doctors are very bad at dealing with patients with chronic symptoms.
Yeah.
So I will, I think it's very difficult to deal with that. And I also agree with Kris that if the decision is between chronic long-term antibiotics or multiple sclerosis, obviously you're going to choose antibiotics. But the point of these studies were to try to answer those questions. In Dr. Fallon's study, for example, he targeted to enroll 47 patients with chronic Lyme disease. He ended up with fewer than he targeted. I think it was something like 37. He tried 45, and he ended up with 37. To get those 37 patients, he screened something like 3,300 patients or more to end up with only those, because so many of the patients that they were seeing had no evidence of Lyme disease. So it's not that they don't have problems or symptoms. It's just that there's little evidence that Lyme disease. There's no evidence that Lyme disease is the cause. So
Pam, you're shaking your head as Dr. Shapiro is talking about the question of evidence.
It's just that they didn't have the evidence that met the very restrictive standards of the IDSA. I mean, then that gets into
IDSA again is the Infectious Disease
that
Society.
gets into circular thinking about what is Lyme disease. Dr. Fallon was trying to get the very tip of the pyramid, and I know that's so because I spoke to him. I don't think that he felt that none of the other patients had Lyme disease. He was just trying to get those for which the evidence was absolutely incontrovertible